I look forward to it. I would like to yield 5 minutes to the gentleman from Tennessee, Representative Duncan.
The gentleman is recognized for 5 minutes.
I thank the gentleman for yielding, Madam Speaker, and I rise in support of this resolution to honor our veterans who did so much to preserve our freedom during the Cold War. It is unfortunate that we are maybe about to pass a massive health care bill that will take away an important part of that freedom that those veterans worked so hard to preserve. Madam Speaker, Robert Samuelson, a very middle-of-the-road economics columnist for the Washington Post, wrote a column this week entitled "A Cost Control Mirage." Mr. Samuelson wrote that the health care plan we will vote on tomorrow, quote, evades health care's major problems and would worsen the budget outlook. He added that, quote, it's a big new spending program when government hasn't paid for the spending programs it already has. Every government health care program has far exceeded all cost expectations and has cost many times more than was predicted. Medicare cost just $3 billion the first year it was created, and $453 billion last year. Its unfunded future liabilities are estimated at a whopping $38 trillion. Medicaid is also out of control at both federal and state levels. Last week, the governor of Arizona estimated that this new health care bill would cost her state alone $4 billion that they do not have, when Arizonans are already facing their biggest deficit ever, over $3 billion. Most states are in their worst shape ever financially, and yet, according to the Census Bureau, 10 states would have to expand Medicaid coverage by more than 50%, and 33 states would have to expand by more than 30%. The states simply cannot afford all the mega billions this bill would order them to spend. Our senior senator from Tennessee, Senator Alexander, said Congress, quote, set out to reduce health care costs, but that this bill, quote, will do the exact opposite. He said this bill, quote, will increase health insurance premiums, raise taxes, cut Medicare, and dump millions into Medicaid. Of course, the bill is so long, so complicated, so confusing, that the Speaker of the House was quoted as saying we would have to pass it to find out what is in it. And one of the Senate Democratic leaders said on the floor of the Senate even he did not know all that was in it. Now the Congressional Budget Office has apparently cooked the books and filed a very misleading report attempting to show a cost of less than $1 trillion. To do this, among other budget gimmicks and manipulations, the CBO was told to count phony savings such as over $400 billion from cutting doctors' payments by over 20% and never raising them back up again. This will never happen. Another huge phony savings comes from cutting Medicare. Dr. David Gratzner wrote in a column in the New York Daily News last December, quote, it's that time of year again. Washington is talking about cuts to Medicare. President Obama's health care reforms depend on them, up to $400 billion over 10 years. Dr. Gratzner wrote, as a psychiatrist, I'll break the news gently. Medicare cuts are like Santa Claus and his flying reindeer, often talked about, never actually seen. The Weekly Standard magazine published an analysis of this bill 2 days ago, estimating the bill's real cost during its first decade at $2.5 to $3 trillion, more than double or triple the CBO estimate. Then there are the tax increases on everything from medical equipment producers to tanning bed operators to $210 billion in new Medicare taxes. Then there are the fines of $695 for individuals, or up to 2.5% of household income, against people who do not buy insurance, and the employer mandate of $2,000 per employee if they do not provide insurance. The bill starts the tax increases immediately, but 98% of the benefits do not take effect until 2014. 2 lawyers from one of the nation's most prominent law firms wrote a column for the Washington Post entitled Illegal Health Reform. David Rifkin and Lee Casey wrote that this bill is without question unconstitutional. In the early 1990s, Madam Speaker, I went to a reception, and the doctor who delivered me came and brought my records. I asked him how much he charged back then, and he said $60 for 9 months of care and the delivery, if they could afford it. Medical care was cheap and affordable for almost everyone until the mid-'60s. Then we took what was a very minor problem for a very few people and turned it into a massive, major problem for everyone. Anything the federal government subsidizes, the costs just explode. There are many things we can do to bring down the cost of health care, but this bill will cause costs to go up even more. And getting the federal government into health care in an even bigger way will eventually lead to shortages, waiting periods, and a decline in the quality of care, all at greater cost. This bill in the long run will end up hurting most poor and lower income and even middle income people. It should be defeated.
Expired.
Thank you.
The gentlewoman from Guam has